3D printing in medicine. Module 8. Lesson 1. Practical uses of 3D printing in clinical and surgical applications. In previous modules, we explored the fundamental principles of 3D printing, from CAD modeling and segmentation to slicing, post-processing, and regulatory standards. Now, we turn our focus to the real-world applications of 3D printing in medicine. This lesson examines how additive manufacturing supports healthcare by improving patient care, surgical precision, medical training, and emergency response. Key applications include the use of 3D printed anatomical models, custom prosthetics, patient-specific implants, and personalized surgical instruments. Additionally, we will discuss how 3D printing played a crucial role during the COVID-19 pandemic, addressing supply chain shortages in critical medical equipment. 3D printing in emergency medical responses. Rapid manufacturing of replacement parts during the COVID-19 pandemic. During the COVID-19 pandemic, global supply chains struggled to meet the demand for personal protective equipment, PPE, and medical device components. 3D printing provided an immediate solution, enabling hospitals and manufacturers to produce critical medical components on-site, such as ventilator valves and oxygen splitters. When ventilator shortages occurred, 3D printed valves and splitters enabled multiple patients to use a single ventilator safely. Face shields and PPE components. Open-source designs allowed mass production of protective equipment for healthcare workers. Swabs for COVID-19 testing. 3D printing facilitated the rapid production of nasopharyngeal swabs, ensuring a stable supply for testing. Supply chain resilience in medical equipment. Beyond the pandemic, 3D printing continues to improve medical supply chains by allowing hospitals to fabricate spare parts for critical equipment locally. This reduces reliance on external suppliers, mitigates delays, and ensures continuous operation of medical devices such as MRI machines, infusion pumps, and dialysis equipment. 2. Patient-specific models for surgical planning, simulation, and training. 3D printing from medical imaging data. By converting DICOM images from CT and MRI scans into 3D printed anatomical models, clinicians can visualize patient anatomy in physical form before surgery. These models enhance surgical planning. Surgeons analyze complex cases, such as tumor resections or vascular malformations, using patient-specific models to determine optimal approaches. Medical training. Students and residents practice procedures on realistic anatomical models instead of cadavers. Patient education. 3D printed models help patients better understand their conditions and treatment plans. Case study: cardiac surgery and tumor resection. In cardiology, 3D printed heart models allow surgeons to plan complex congenital heart defect repairs. In oncology, tumor models assist in precise tumor excisions, reducing surgical errors and improving patient outcomes. 3. Custom prosthetics and implantable devices. Personalized prosthetic devices. Traditional prosthetics are often expensive and require lengthy fabrication times. 3D printing enables the rapid production of prosthetic limbs, customized for individual patients at a lower cost. Advantages include custom fit. Personalized limb sockets improve comfort and function. Affordable solutions. Reduced costs make prosthetics accessible in low-resource settings. Lightweight and durable designs. Advanced materials such as carbon fiber composites and flexible polymers enhance wearability. 3D printed implantable devices. In orthopedic and craniofacial surgery, 3D printed titanium and biocompatible polymer implants provide tailored fit for each patient, improving integration and reducing rejection rates. Porous structures for bone growth, enhancing long-term stability. Accelerated production, reducing lead times for critical implants. Case study: cranial reconstruction and spinal implants. A 3D printed titanium cranial plate was successfully implanted in a patient with a traumatic skull injury, restoring both form and function. Similarly, custom spinal implants improve alignment and fusion in spinal surgeries. For personalized surgical instruments. Customized tools for precision surgery. 3D printing enables the production of custom surgical instruments, tailored for specific procedures and patient anatomy. Examples include patient-specific cutting and drilling guides. Pre-shaped guides ensure accurate bone cuts in orthopedic and reconstructive surgeries. Custom clamps and forceps, designed for minimally invasive procedures. Single-use, sterile surgical tools, reducing cross-contamination risks. Advantages of 3D printed surgical instruments. Enhance surgical accuracy. Guides improve alignment in joint replacements and osteotomies. Faster procedures. Custom tools reduce intraoperative adjustments. Lower costs. 3D printing minimizes reliance on expensive, mass-produced instruments. Case study: 3D printed cutting guides for knee surgery. A patient-specific cutting guide was used in a total knee replacement, reducing surgery time and improving implant positioning. 3D printing has transformed medical applications, from patient-specific surgical models and custom prosthetics to personalized surgical tools and emergency medical components. These innovations enhance precision, efficiency, and accessibility in healthcare. As materials and printing technologies evolve, the role of 3D printing in medicine will continue to expand, driving advancements in patient care, surgical outcomes, and medical manufacturing.